Wilderness Health, a collaborative of independent healthcare providers in northeastern Minnesota and northwestern Wisconsin, recently conducted listening sessions and a public survey in Cook County to gather information about digital and internet opportunities. And joining me now to share and discuss the results of the survey are two individuals from Wilderness Health, Zomi Bloom, a telehealth program manager, and Chance Lasher, a telehealth intern. Thank you very much, you two, for taking some time. I appreciate it.
Thank you. Happy to be here.
Yes, happy to be here.
Zomi, I would love to kind of start with you. Can you just share a quick snapshot of Wilderness Health and just the role that it plays in providing healthcare to rural areas of Minnesota and then Wisconsin?
Absolutely. So Wilderness Health is a collaboration of 9 independent healthcare and hospital systems, mostly in northeastern Minnesota and some in northwestern Wisconsin. We are passionate about making sure that rural folks have access to good quality healthcare. We bring our providers and hospital systems together for roundtables, committees, and other different activities so that we can work together on improving patient care.
And Chance, maybe I'll switch over to you. Wilderness Health recently conducted listening sessions and surveys this summer in Cook County, where they gathered information from residents about internet and digital access and just how it relates to healthcare services such as telehealth. And this was just a kind of a collaborative with healthcare individuals and community members to gather this information. Can you share who all was involved within this process?
Well, Wilderness Health was working on part of the Department of Employment and Economic Development to gather the stories behind data around internet and digital equity. In Lake and Cook County, we looked around. Yeah, and we've worked with several local partners in Cook County to sit down with residents and build that trust and make sure we were gathering and feeling comfortable gathering these stories. So in Cook County, we sat down at Grand Marais with the senior hub, the library, as well, collected some surveys for us, and we went up to Grand Portage, Band of Chippewa, and talked to some folks at the elderly nutrition program there as well.
Yeah, wonderful.
So,
yeah, kind of a nice collaboration of partners to gather some of this information.
Mm-hmm.
Zomi, let's talk about some of the survey results. Can you share some of just the key findings from the recent survey conducted in Cook County and Lake County, and what did the results show?
Yeah, absolutely. So I just want to start and just say that we know and we believe that internet and digital technology access it's a real equity issue, right? Having access to have resources can improve people's lives with more access to healthcare, shopping, information, connecting with friends and family. So what did we hear? Most people we heard from in Cook County want to use technology and the internet. But there are barriers that we need to address. So these barriers could be around equitable, affordable access to internet, access to devices, and support in using them. And we have a variety of stories if you'd like to hear some of those.
Yeah, I would love to.
All right, so I'll tell you one. One gentleman shared that he lives off the grid and he uses Starlink for internet. Before he got Starlink, he would make notes of all of the things that he wanted to look up on the internet, like home repair topics. And then he'd look them up when he went into town. Now he has access at home, but he limits his usage because it requires electricity. We also heard a story of a woman who shared she uses telehealth for her mental health therapy. This saves her a lot of driving time. Another story we heard kind of around the cost and the access issue is a woman who shared that the homeowner who lived in the home previous to her had not elected to have a broadband line run to her home. Now, if she wants to get broadband, it's going to cost her thousands of dollars if she wants to get that at her house.
Yeah, that's kind of a nice little snapshot of just some personal stories and how internet access or inability to have internet access kind of impacts individuals within Cook County. I'm sure you've heard quite a bit of stories.
Absolutely. The stories have been amazing. That was the most fun part of this project, is really getting to hear people talk to us.
Yeah. And kind of looking through some of the results that you had shared with us here at WTIP, basically out of the 141 respondents just in Cook County, both online and in person, 23% said that their largest issue was technology, kind of as you had just touched on. Do you have any other statistics that you'd like to share that were presented within the survey results?
Sure, absolutely. So, nearly a quarter, 23% of respondents said that their home internet was disconnected for 5 days or more due to a technical problem. Like it could be bad weather or some other kind of reason. 20% of participants listed expensive internet as the main access issue. And 26% of them said that they use the internet to access healthcare services once a week. So that's kind of a lot. We think it's really interesting when we hear about the internet being down for 5 days or more. Sometimes, it could be even a couple of weeks. And I think folks in metro areas do not understand that. Maybe they have their internet down for half an hour, maybe an afternoon, and that's an enormous inconvenience. Whereas in these remote rural areas, that happens and it's a really big deal.
Yeah, absolutely. How would you say? Obviously, telehealth has grown and expanded in recent years, and especially during the pandemic, it became a very valuable resource and tool. Can you expand on just some of the benefits of making healthcare more accessible in Cook County and just other rural areas?
Absolutely. We really feel that everyone deserves to have the same access to healthcare no matter where they live. One of the areas where telehealth has been enormously successful is getting better access to mental and behavioral health care. We know based on data that we have through our Medicaid Integrated Health Partnership data that mental and behavioral health issues are really powerful drivers of healthcare in the North Shore. And by using telehealth, folks are able to access a psychiatric provider and or have a follow-up visit with their doctor to make sure that their depression medicine is working okay, or even get to therapy visits even more. We also know that in Cook County, you might be driving 2.5 hours just to get to a doctor's appointment, especially if it's a specialist. So having telehealth available really makes sure that people have better access to the specialists that they need.
Yeah. And Chance, can you touch on just maybe how the process was for conducting these listening surveys, and maybe were you surprised by any of the results, or what were your thoughts after looking through some of the survey results?
Oh, well, I guess what struck me the most is people are very interested in improving their access to internet and digital opportunities, and people were saying how much they value local spaces for that too. I think of all the places we went to, there's a want for more training for some digital resources too. Folks just felt like they couldn't keep up with technology, especially, and also the value of libraries as a source of going there for internet when things are down. And lots of other folks would say resiliency and having that independence too. They would like to have, some folks said they like to have a second landline as well in their homes, or another option of communication when internet does go down or things like that. So I think those are the most striking things that people are really impressed and or want to learn about how they can improve for themselves and their communities.
Yeah. And Zomi, looking through the results of this survey, how did Cook County's results essentially, or Lake County's results, compare to other rural areas within maybe Minnesota or just Wisconsin? Are they pretty similar across the board looking at other results?
Absolutely. So I would say some of the individual stories might have been different, but we have had the benefit to be coordinating with Northspan, which is a group that has brought digital equity committees together throughout northeastern Minnesota. There are a lot of common themes, such as folks who did not grow up with technology may want to use the technology. However, as soon as they learn a new skill, the software changes. Or older folks might be victims of phishing scams or other cybersecurity types of issues. There's a lot more. There's a lot of fear there and some education that's needed throughout rural areas. The rock formations might look different or the water formations might look different, but across the board, the geography of northeastern Minnesota is tough. And affordability in rural areas is definitely an issue. One of the things we really wanted to do with our survey collection process is make sure that we had paper surveys. So I think if some of the groups that maybe didn't have paper surveys didn't get to hear all of the voices. And we really felt that if we don't have paper surveys, then the people who are not using the internet to do this internet survey are not going to get to share their voice. So we're really proud of being able to talk with folks who said, I don't use the internet. And we're like, yes, we want to hear from you as well. And so they helped inform some of those common themes across our region.
Yeah, and I know that, the hub here down in downtown Grand Marais, I think was a part of it. So I'm sure they had paper copies there. And I think the library was involved too, and a couple individuals within North Shore Health too. So Yeah, it's great to kind of get just a nice little collective of how people use internet and maybe where some holes may lie potentially. So can you share what comes next? So what are you going to do essentially with the results of this survey and what are the next steps?
Absolutely. So I'll start and then I'm going to let Chance talk a little bit too. So we at Wilderness Health are working on a longer term strategy to figure out how telehealth can be sustainable into the future. So we're going to be using this to build up programs. And so sometimes that means partnerships with organizations who can help folks with technology like the Hub or like Lighthouse Center for Vital Living, which is out of Duluth, but serves the whole region. We have also reported the results back to the state and are encouraging folks to attend digital listening sessions. So I'm going to turn it over to Chance to talk a little bit more about those digital listening sessions and the digital equity plan too.
So we've collected data from Lake and Cook County this summer, and there was a statewide effort. Several committees would work across the state and turn in all their plans to the state. So we have a mostly comprehensive surveys of Minnesota in a lot of places. I think there were around 90 committees that did this work. But in any case, DEED is collecting all this, and they have a draft plan for digital opportunities for the state. So there's still time to add your voice to this draft plan and visit some of these listening sessions. So for up in our neck of the woods, there's going to be a listening session in Two Harbors on September 27th. And there's also going to be some virtual sessions as well if you can't make it to that one. You can read a copy of the digital plan on DEED's website in a draft plan, and you can mail in some comments if you don't have access to the internet. And you can probably access the plan at your local library. You can ask them as well. But yeah, we want more voices. The Cook County residents, it's important to get their voices on this issue.
Yeah. I'll make sure to include a link to the survey or the website in the article once we put that on our website on WTIP, just in case more people would like to fill out the survey. And then obviously if they're not able to make that September date in Two Harbors.
And I'll just clarify, I think that date is actually September 19th for Two Harbors.
Perfect.
September 27th is a virtual session. And by September 29th, the state wants to have results back. And there is a beautiful flyer that we can share. So it has all that information on there.
Wonderful. So public comment period kind of wraps up and they want all of that information by September 29th. So only another week and a half or so. Yeah.
Yep.
Great.
Yep.
Chance, Zomi, is there anything else that you would like to add or share about just the process and maybe about the digital opportunity plan?
I'll start. I just wanted to say thank you to all of the Cook County residents and all of the groups that we worked with and gave us space and opportunity to collaborate, the YMCA, the Hub, Grand Portage, North Shore Health. I'm sure I'm forgetting some folks, the library. It was just really an incredible experience to hear all those voices. And I just want to emphasize that the state of Minnesota really does want to hear the voices from Cook County. They're valued. They're important in the digital opportunity planning process. And in visiting with Cook County, we really hope that you did the county justice in bringing those voices back to the state.
Wonderful. Perfect. Well, we've been speaking with Zomi Bloom, a telehealth program manager, and Chance Lasher, a telehealth intern at Wilderness Health. I really appreciate it. Thanks again, you two.
Thank you so much. Appreciate your time.
Thank you.